let me know when we're good to go. Okay. Good morning, Statesboro. I'm coming, bringing greetings, and wishing we was coming out on a better note. With that being said, I do want to thank everyone for coming out and spending a little bit of time with us as we navigate ourselves through this very difficult moment within our community. Statesboro is not immune to the pandemic that we're seeing across the country, and we feel that we got to step up and do what we need to do to navigate ourselves through this situation. I want to recognize everyone that's here. To my right, I have our County Commissioner, Chairman, Mr. Roy Thompson. And to my left, I have the Director of Public Safety for Bulloch County, Mr. Ted Wynn. We're both excited about having you guys here, and we really appreciate all of the hard work that you've been doing to help navigate our community through this. I think the one thing that we understand through this entire experience is that this is a all of us matter. We all have to chip in to do our part to keep our community safe. Post my remarks, we will all be available for questions following up. So if you guys have any questions beyond that, we'll be more than happy to get those taken care of. Cumulative right now, the Bulloch County and the city of Statesboro, we have 2,000 cases that's been reported of COVID-19 in Bulloch County, along with 21 deaths. These numbers are entirely too high. We wish these numbers were not here, but this is where we are today. Over the past 4 days, we've seen nearly 4,000 new cases of COVID-19 within our community. Currently, the Georgia Department of Health reports that Bulloch County has a 16% infection rate per 100,000 people. The Department of Public Health says that number needs to be less than 5%. So we are 11 points higher than we actually need to be. Right now, we have more than 500 cases per 100,000 citizens that's within our county. We need to reduce that rate to in and around 100. Yesterday, the New York Times ranked the city of Statesboro as a number 6 city in the nation with the greatest number of new relative to population cases. In complete transparency, we want everyone to know that this spike is not coming as a surprise. This is something that we've been preparing for months. And our community is now currently in the crosshairs of what we believe is a perfect storm. On August the 17th, both our public school system and our higher educational institutions, they all went back to convene their classes. As a result, we have seen an increased amount of socialization, which is normal for young people, and that has resulted in a tremendous increase in the numbers that we are seeing today. Georgia Southern University reported that it has had roughly 500 cases. The university has been extremely transparent in its fight to keep its student population and the greater community as safe as possible. They've been working with the Department of Public Health to expand testing and have set aside space for quarantine needs. In a conversation with Dr. Morero on yesterday, the Statesboro campus is currently using 9 of 60 available spaces. So we feel that we do have capacity there, and we want to thank that institution for everything that it is doing to keep their students safe and our greater community safe as well. The one point of light in this situation is that the leadership from the community understood that a moment like this was highly likely and have been working diligently to not only prepare our organizations, but to prepare the populace as well. Last spring, we had 3 significant things that occurred that helped us tremendously. One, the students at Georgia Southern were sent home at their spring break, and the classes for the remainder of the spring and for the summer were all online. That was a tremendous help to our community, and it aided us in our ability to get prepared to handle this situation. The second thing was that the public school system ended their year early and allowed their students to continue online. That was a tremendous help in aiding us to get ready as well. And then the city, we halted all high-touch businesses, barbershops, beauty salons, massage therapists, and things of that nature to give us that time period to really prepare us to be able to navigate this particular situation. Since the reopening of the state, the city of Statesboro has adhered and enforced all parts of the governor's executive order. Where we felt the need to fill in the gaps, we worked to build public support with local businesses and citizens in an effort to keep our community safe. In addition to this work, we partnered with Squashing the Spread Bulloch, a local group of dedicated volunteers. And with this collaboration, we've been able to distribute more than 50,000 masks collectively. And then with Georgia Southern as well, more than 70,000 masks have been distributed throughout our community. And these masks are going to students, they're going to citizens, and they're going to local business owners as well. Coupled with this, the mayor's office sent out letters to local businesses encouraging them to join us in the fight against this common enemy. We sent this letter to every single business that is registered with the city of Statesboro, and that was more than 1,200 letters that we got out to the greater community. On August the 18th, the mayor and council voted to pass a mask mandate as we understood that the influx of the population due to returning students was going to be a huge factor in the matter that we're seeing today. We're currently working with the Department of Public Health to expand testing capacity at its current location and are now scouting for new locations to further expand testing capabilities. It is extremely important for us to continue to test because that allows us to identify, quarantine, and make sure that we do that follow-up tracing. The message that we want to state clearly is that to our community is that this is a all of us fight. All of us have to come together to fight this common enemy. We must work together to protect our community. We must wear our mask when we are in public. We must watch our distance. We must wash our hands, and we must stay at home as much as possible and try to make sure that we're making those trips in public as needed. We are definitely wanting everyone to know and to understand that we are following the executive orders that's coming out of the governor's office. The mandates that we have passed, they come straight from the executive order out of the governor's office. So we want everyone to know that the city of Statesboro is in line with the fight across the state and across the nation as well. As mayor and neighbor, I am asking you all to do your part in our community to bring the borough back to what we know and what we love. Together we can overcome this. I thank you guys for everything that you are doing. This fight is not over, but Statesboro will continue to fight because we are strong, resilient people, and we are definitely going to see a brighter day beyond this point. At this point, I will open it up for any questions that anyone may have.
We'll start with Kelly. Good morning. Quick question. Do you know how many businesses opted out of enforcement at their businesses?
We don't know the number of businesses that opted out. What we can tell you is that we're asking all businesses to opt in. But based on the governor's executive order, one of the easy things that they wanted to do if they wanted to opt out is to place that sign in their window. If that sign is not there, then it is assumed that they are opting in to the mask mandate. So, but we are encouraging all businesses to opt in. And we're hoping that we're going to get a greater number after seeing where we are today to understand the seriousness of the matter that we are facing. So we don't know the number of businesses that opt out, but what we can tell you is that we've asked 100% of the businesses to opt in.
The vast majority of Georgia Southern students live off campus.
Yes.
Those that live on campus, there may be a little bit more structure there, closer to a bubble, maybe not an entire bubble. But for the folks that are living off campus,
Mhm.
that are as much citizens of Statesboro as they are Georgia Southern, what is your message to these folks? You know, if they're 18-year-olds and they're off on their own for the first time, or they're upperclassmen that have been in Statesboro before, as we're dealing with this, what is your message to these young people in terms of culture and social life and everything else that is supposed to be going on a usual fall semester?
Yeah.
What's your message to those folks in terms of how they need to tailor their lifestyles and cultures and everything else right now?
Well, one thing that we got to recognize is that socialization is a natural part of human behavior. And so with that being said, at 18, 19-year-olds, they have that natural desire to socialize. And I think we all were at that point in our life. But I think that each generation, our country has asked each generation to do something special and heroic for the betterment of the greater good. And in this time period, the thing that we're asking of this younger generation, this Gen Z and millennial generation, is the sacrifice that we're asking you to make our country better and to save our community is to mask up, watch your social distancing, and make sure that you are washing your hands repetitively. And one thing that we want to be clear on this is that this is a small sacrifice that can have a greater good down the line. Because when we take these measures, not only are we working to save our lives and keep our families safe, we're doing that for our greater community, and we're working to save the vitality of our local businesses and our economy. So the ask of this generation is that you do your part to help our nation to navigate this difficult part of our history in dealing with the COVID-19 virus.
Has the city taken any enforcement actions against bars or restaurants that have had people congregating unmasked and undistanced? And with the way the governor's order is written, is there anything that the city can do?
Well, the way that it is written is that if they've opted into the mask mandates, they are subject to the enforcement. What we've had law enforcement to do is to go out and address crowds that are bigger than what they should be. But more than that, we're actually passing out masks as well, because we still want to continue to build a coalition through consensus. And what we know is that we can be more effective if we're getting people to opt into supporting measures that's going to keep us safe. To date, we have not written any citations, and the goal of this is not to go out and ticket individuals without masks. The ultimate goal of this is to make sure we're taking every measure to keep our community safe.
That's no citations against anybody as far as the mask?
Yes.
You stated several times that you were just following the governor's ordinances and public health warnings, I guess. Do you think that the governor and the state government have done enough to make sure that this outbreak doesn't get as large as it has gone? And do you think that there's enough things in place to make sure it doesn't get any bigger?
I absolutely believe that we could have done more at the state level to keep our communities safe. And what I firmly believe is that I believe in the concept of home rule, because those that's here at the grassroots level, we are living beside our neighbors every single day, and we're seeing the issues that they're facing. And what I will say is that I've been to far too many COVID-19 funerals. And when I'm at these funerals and I'm consoling family members, I cannot help but think, is this something that we could have done a better job in saving lives within our state? At some point, the heartbreaking part of this is that there's been a deliberate distribution of misinformation as it relates to COVID-19. And this misinformation has been directed towards individual political views as well as their religious views. And what I failed to get, I did not get the memo where the CDC, the World Health Organization, and Johns Hopkins was no longer credible means of information when it comes to public health. So I believe that if we would have stepped to the science and did the recommendations at the beginning and had that shut down from 6 to 8 weeks, I believe we would be in a much different place than where we are today. And when you're in a role of leadership, you have to have the moral fortitude to do what's right, regardless of what the political situation may be. And I think that that's what we lacked in this particular situation, because if we would have took that 6 to 8 week period, I just simply do not believe that we would see the numbers that we're seeing in the state of Georgia within our community, as well. So I do believe we could have done more.
And just to follow up, are you hoping that the governor will give more opportunity for local cities, towns, whatever, throughout the state of Georgia to make their own ordinances and do what they think would be best for their communities?
Yeah, well, this is what my hope is that if the governor is not willing to take those measures, then I think that we should be able to take those measures on the local level. And I say that simply because of the fact that somebody has to be able to step into that void of leadership and do what's right for our communities. At the end of the day, we have to save lives. And us as a nation, and when we compare our response to COVID-19 to other nations are getting past this in a 3 to 4 month time frame. And we are the United States of America. And if you had told me at any point beyond this, that the thing that was really going to, that was really going to affect us was our inability to deal with a pandemic, and we would spend trillions of dollars in response to it, I would not have been able to take that seriously. And so now, in hindsight, the thing that I'm most concerned about is the fact that we've allowed politics to supersede science, and people are dying as a result of that. And so what we have to do is that we got to remain vigilant in our ability to take care of ourselves, our families, and our community. But there has to be another narrative, simply because of the fact that we have so much misinformation that's being put out as fact, and people are believing it, and people are dying as a result of it.
Is Chairman Thompson going to speak separately?
Yes. Mm-hmm.
All right.
Yes.
You can address questions right now to them.
Yeah.
Just going to ask you, is there anything that the county can do and is looking at doing further in regards to enforcement or encouraging people to comply and be safe?
Let me answer to the microphones for those of us recording.
Can you hear me with the mask on?
So,
Okay. I wanted to mention something to you, and I've got a little bit different take on this. I have a grandson with cystic fibrosis, and he's 28 years old now, and he asked me a question just this morning. I let him read the ACCG, the Model Public Face Mask Ordinance, and the Local Option Face Covering Requirement. And he read it. I said, what do you think about it? He said, why do you even think about putting a mask mandate on the citizens? Because with all of the opt-outs, they give you the reasons that you don't have to do it. It's printed right there in this mandate, in this bulletin. He said, why would you even think about doing it? Now, he has been quarantined since March. He does everything that he's supposed to do. If he does get out to go get something to eat or something, he's got his mask on. He's one of those that has to do 4 treatments a day with pounding. I don't know if you know what cystic fibrosis is, but he is an ideal example to use. But for him to ask me that question about a mask mandate, the city has not adopted a mask mandate at present time. Now, we're going to discuss it tonight, and don't know what will come out of that discussion. It'll be whatever the commissioners would want. We'll put input into it. But I wanted to address the mask mandate issue. If people would use common sense and wear a mask when out in public, we could control all of this increase in positive tests, I feel, if people would do it. It's not, leadership is only as good as the leaders as the people you're trying to lead. If they will not comply to the orders at hand, then we have a serious problem. And I know we have a big uptick as far as in positive cases at present time. But it's like the mayor said a few minutes ago, it's nothing unexpected. Bring all the local school kids together, bring Georgia Southern back, bring East Georgia, bring all the universities back, and we're bound to have an uptick in Bulloch County. And, you know, we were talking to Dr. Marrero yesterday, and he said hopefully in 3 weeks' time, you'd see a downward with negative testing, downward with the positive test. And that's what we're all looking forward to. But we as individuals, I can't do it for you. You can't do it for me. You're going to have to do it for yourself. You're going to have to put the mask on. The issue that we have, some people will not wear a mask. I don't care what you say to them or what you do, they'll want to, they cop an attitude, they want to fight. And until, the only thing we can do is encourage people to wear masks. And I think then if the test then starts lowering on the positive side, then you'll see more and more people wearing masks. Yeah. And, who's going to protect me from you? It's going to be me. Who's going to protect you from me? It's going to be you and me. Now, that may sound odd, but if you don't have on a mask, I don't have on a mask, and I go over there and I'm subject to the 19, then chances are you're going to catch it also. So I know I've said a lot about masks, but I think that is probably the most important thing, even though a lot of people do not believe it. I think that's the most important thing that we can do is wear a mask and protect ourselves and also protect you.
You said that you were expecting an uptick when you bring back, all the public schools and then of course the college in the area. Were you expecting to see such a large uptick that would launch you straight into the top 10 in the nation for several different COVID-19 statistics?
That's a very difficult question to answer. I heard the mayor say yesterday, and correct me if I'm wrong, y'all tested the employees up here. It was 100 and some odd employees that were tested.
Yeah, we have tested, how many was that? How many? 105.
And you had 21. So that's more, that's a little bit less than 20%. So if you take 10,000 students, that's 20%, it's 2,000 students. So I would say with as many people as come in here at one time, no, it's not over what I had expected. And I wish I had that magic number I could give to you, but that's the best answer I can give.
Thank you.
And it might be a question for Mr. Wynn. With this level, is our local healthcare system taxed? That was a concern back in the spring, and certainly the numbers weren't as high as now. But then again, a lot of the people who are testing positive now are younger.
Currently, no. The health system is handling the load, but I think that's what this is about. It's about squashing that spread and making sure that it can continue to handle that load. I'm pleased that the mayor and the chairman and the county and the city partnered on this very early back in March when this pandemic started. From the time we met here that Monday morning at 8 o'clock, the city and county have been united, and the county was fortunate to get over 70,000 masks, and we made those available. And as the mayor said, we've distributed those, but I think it's important that we emphasize here this morning that people take personal accountability and do the things that they should. And I agree with Dr. Marrero from the college, from the university, that we'll probably in 3 to 4 weeks, we'll begin to see a downturn on these numbers. But it's what we do in the next 3 to 4 weeks that's critical in making sure that this spread is squashed.
Yes, you're the source of the daily numbers. And some people will say, well, you can make numbers say whatever you want them to say. For folks that are questioning the statewide or national numbers, the test results, the percentage that are positive, what do you tell those folks? What do you counter back to them, the ones that are saying, there's so many false positives. The vast majority are false positives. The number that are actually there is small. What do you tell those folks for the concept, whether the numbers are correct or not? What do you tell them in terms of the concept of reducing whatever those numbers are?
I would just tell people to trust the science and follow what the scientists and the experts say, and not what the politicians say. That's what I would echo is if folks are telling you that wearing a mask stops the spread, then we need to do that. And if you look at the numbers, I think that the uptick that we've had here, as they said, is an indication of the populace that has come in. But I think if we do right, I think in 3 or 4 weeks we can begin to see this go down. I have a personal story just like the chairman does. I have a mother that's in a memory care unit right now that I haven't seen since March. I have a father that's in long-term care that I haven't seen since March. So it impacts people differently, but it impacts us all. But I think if we all pull together and do the right thing, we can make this go the other way. Anything else for me?
Today?
Sorry, just for the mayor. So just to make sure I have this correct, so you guys will be looking at doing any sort of mask ordinance or mask mandate tonight at tonight's meeting?
We've already passed the mask mandate for the city. I think the county commissioner meant to say county versus city. So we've already passed ours. We passed ours on August the 18th. And so the county is going to be discussing it tonight. And so, and I think, and Mr. Roy, he and I talk all of the time. I am in favor of the county doing so, and that's a decision on theirs. But the reason why I am in favor of that is because it sends a resounding message that we are united. Georgia Southern University has passed a mask mandate. The city of Statesboro has passed a mask mandate. And so we need to eliminate any space for any of those individuals that Dow referenced. We got to eliminate that space where they're going to be able to say, okay, mask doesn't work. That's demonstratively not true. Mask reduces the spread of the coronavirus by 70%. And those are the facts that we have to really stick to. And myself, Director Ted Wynn, Commissioner Roy Thompson, we do not have the luxury of being able to make decisions that's based on opinion. We have to make our decisions based on fact. And the fact is that we have to follow the science. And the science says that these world-class organizations, such as the Center for Disease Control, the World Health Organization, as well as Johns Hopkins, they have dedicated professionals that's been educated in the field. That's what we're following. And so we're going to stick to the scientists, and like Director Wynn said, we'll leave the politics to the real politicians. We're trying to save lives and businesses in this community.
I'd like to ask a question. My name is Frank Davis. I'm a retired strong surgeon.
Yes.
2 weeks ago, on behalf of Rice Connect, it's great to see y'all working together and trying to solve this problem. The people that we really need to communicate, are not in this room right now.
Yeah.
So can maybe you or Mr. Wynn address what's going on between the city, the county, and the school? Because I think it's the college kids, what they do, not during the daytime, and structured environment is, the reporter mentioned earlier, but it's what they do off hours.
Yeah.
Because of the quarantine fatigue. They worked hard all day. They, so I think it's communicating with the campus and making sure the campus communicates clearly that, they're the ones that can fix this. Unfortunately, more so than you or anybody in this room.
Yeah, well, I think one thing that Georgia Southern has done that's shown to be somewhat effective is the fact that when they through their contact tracing, they was able to identify that the uptick in cases that they saw, nearly half of those came from Greeks and a rush that occurred prior to classes starting. So they immediately communicated with these organizations, and what these organizations have done is that they've moved all social events online. So that's a win that we definitely want to take. And I think at this point right now, I think that was the occurrence that need to happen for our students just getting into this new environment to understand how serious this is. So I think we're moving in the right direction there. And I think that the university has done a phenomenal job as far as communicating, not just internally, but externally as well. But Georgia Southern does not operate in a silo. The city does not operate in a silo. The county does not operate in a silo. We got to all continue to work together, the same messaging, the same strategies to make sure that we can touch as many people as possible. But our strongest ally in the midst of all of this are the citizens. These are the individuals that are in the most powerful situation. You know, like our Commissioner Roy Thompson said, is that we need individuals to advocate to each other the importance of following CDC guidelines as it relates to stopping the spread of this. So we need our citizens to anoint themselves as COVID advocates and making sure that we are working together to continuously spread the word that the CDC guidelines, they do work. And where we've seen them implemented at, we've seen a downtick in the spread and the number of cases. So if that's the scientific information you're looking for, there it is right there.
Ms. Clark?
Yes, thank you. Tell us more about the expanded testing. Is that likely to be the National Guard back out at the Ag Center? And do we have a timeline for when that might happen?
We were on the call with the Department of Public Health this morning with Dr. Parks and her team. And what we're doing right now is that during the testing hours, we're increasing the number of testing during that time frame. And additionally, we're looking for another space to relocate to continue to expand our testing capabilities. That's what's in the pipeline currently. But we are also diligently working with the Department of Public Health to find out what are some of the best strategies to make sure we can keep our community safe.
So right now expanding where it is, but also staying open to another larger, faster space.
Yeah, absolutely. It's currently at a health department now, but what we want to be able to do is find another location so that we can be able to increase our capacity to test throughout the day.
So it could be back out at the Ag Center, possibly.
Right now, city staff and county staff is working with the Department of Public Health. They're going out on tomorrow to begin to scout other areas within the city to identify where that location could be. So as of right now, we cannot definitively say it's going to be in this particular space, but everything is on the table as far as us being able to identify the place that's going to have the best fit for our needs.
Do we anticipate any shortage of testing kits? Are the tests going to be available when we have the space and the personnel to administer them?
That's not anticipated. I think one thing that we've done while we've been preparing for this is our ability to build out our capacity and working with East Georgia, the Department of Public Health, and Georgia Southern. So we don't feel that we're going to have a shortage of testing. But with that being said, we don't know how this virus is going to behave within our community. What we do know is that we're building those relationships that's going to allow us to bring in that additional testing, whether it's at the DPH level or at the state level.
Thank you.
Thank you.
Mr. Mayor, you might add that Public Health is working with Georgia Southern on some specific hours for testing for them too.
I'll let you do that. Okay. That chair looks real comfortable.
Okay. We did learn this morning that behind the scenes, Georgia Southern has been working with Public Health in developing some hours that they can do some testing specifically for students, faculty, and staff. So they are going to try to identify Georgia Southern cases and try to get those taken care of, unique to what they're going to be doing with the city and the county. Yes, sir.
When the health department tests Georgia Southern students, if they do that at Georgia Southern, Will Georgia Southern then acknowledge those as confirmed cases rather than only the cases that it does itself? I mean, only the testing that it does through its own health services and athletics?
That's a question for Georgia Southern.
Thanks, sir.
Dwayne?
The CDC guidelines speak specifically to congregation less than 10 or more. We have churches that are meeting. We have football games about to be played. What's your advice to that?
To follow what the governor's executive order says. If it's over 50, you've got to socially distance. And if you can't, it's impossible to have the event without the disease spread if people get close. So you have to follow the executive order, and that's in place for all events for 50 and above. All right. Anything else for me?
Mayor, you can close this out.
Okay. We definitely want to thank everybody for coming out, and you know, to the local news organizations. We definitely want to say thank you guys, because you have been phenomenal in getting information to the public. So we want to definitely commend you. You two are frontline workers, because you are the ones that's helping us stay informed and communicating safety guidelines. So we want to thank you. I want to close out by saying this. Statesboro, this is a all of us situation. We need everybody on deck. If you have a sign in your yard that says "Back the Blue," help protect them by wearing masks. If you have a family member that's a nurse, a police officer, a fire department employee, to best protect them during this time, wear a mask. This is a all of us. And what I say to you is this: please stick to the science, stick to those individuals that's been in this field for decades and working to keep us all safe. Those are the experts, not the memes on social media, not these focus groups. If you want to save business, wear a mask, because what is killing business right now is the failure of those individuals that refuse to wear a mask and are contributing to the spread of this virus within our community. That is the truth. That is the fact. If you are arguing against masks, you are not helping us. So let us be clear on that. Statesboro, we love you, we appreciate you, and we're going to get through this, and we're going to be stronger and better together. Thank you.